It is an honor and a pleasure to introduce Dr. J. S. Hiremath, who is one of the leading cardiologists of India. He is the director of the Cath Lab at Ruby Hall Clinic, Pune. Sir, need your input about why you would need real-time data rather than wait for 24 hours to get the Holter data. Some cardiologists believe that patients are not serious enough for an immediate treatment and can wait for 24 to 48 hours for the course of clinical action. Please let us know your thoughts on this.
Actually, data is a new age weapon, and cardiologists are also looking for new technologies in enhancing their practices and providing something new for their patients. Online data is of immense use because why wait for 24 hours? There could be some arrhythmia which will be caught and it could be diagnostic, and one need not do the full 24 hours recording at all. At the same time, when a patient is moved out of the ICUs, they may not be cardiac patients at all, but they do need monitoring required of ECGs, their tachycardia, slow pulse rates, and arrhythmias. This telemetry is not only for indoor patients. It can be done at home, and online data could be available with assistance of cardiologists. And they could flash an alarm, so that makes so much sense that if there is some abnormality detected by AI as an abnormality, it can be reported immediately to the cardiologist. So there's no doubt that online 24-hour data has immense value, and we just cannot question that.
What is the necessity for cardiac telemetry in wards when the patients can be kept for additional days in the ICU or CCU? Why would you recommend ward monitoring over prolonged CCU monitoring?
Anything which will bring down the ICU and CCU stay is obviously helpful. A, because you could get those serious beds for somebody who is more worthy of it. And secondly, the CCU costs are extremely high. So if somebody's CCU stay is reduced from, say, 3 days to 2 days, it's going to be of immense help. If the patient once stabilized or shifted to the wards, the only thing they require is the ECG monitoring, and that can be offered by this telemetry monitoring. Doctors are further vindicated in their decision to shift the patient to wards if there is a cardiac telemetry device which enables real-time remote monitoring. The patients on telemetry unit typically have a cardiac condition such as a heart failure, heart disease, or complications of cardiac issues, or they could be just seriously ill patients because of some medical condition.
Another common revert we get from doctors is that we need 3-channel ECG over lead 2. Could you please explain why lead 2 is good enough for monitoring?
I'm an old-time cardiologist trained way back in the early 80s, and I'm brought up by looking at rhythm lead 2. Obviously, it's the most commonly used lead for rhythm monitoring. A bipolar lead with the electrodes on the right arm and the left leg. This is the axis through which most of the electrical current of the heart moves, and that's why you get excellent P waves and R waves most of the times in lead 2. I have no doubts in my mind that if there has to be one lead, it has to be lead 2 for rhythm monitoring.
What is it that you like about Heartbeat's Wi-Fi ECG device, which does real-time monitoring? How are the traces of heartbeats, and why would you recommend it?
The recommendation is because the Heartbeats is the world's first Wi-Fi enabled continuous real-time ECG monitoring wearable device. It provides excellent tracing, has AI to detect abnormalities. It's designed, developed, manufactured in India by a team of Indians. It's fairly wire-free. It's just a single wire. So there's a lot of mobility. Patient can turn to sides and be comfortable with the device, unlike the traditional Holter monitors that we have. And of course, it is all a symbolism of Atmanirbhar Bharat.